Thank you, Tina. Dr. Strang will give us an update on where we stand today with COVID-19.
Thank you, Premier, and good. We're 6 feet apart, so that's good. Today, we're announcing 17 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 90. Where investigations are complete, we can say that all our cases are travel-related or connected to earlier cases. With some of our cases, investigation is still ongoing, and it remains too early to say if there may be community spread. I can say that none of the new cases are connected to the St. Patrick's Day gathering in Lake Echo, which we talked about yesterday, and NSHA had a release on. All of the attendees at that event have been contacted, and testing has been done on those individuals, and results are pending. The 90 individuals affected range from cases under 10 up until their mid-70s. 2 individuals are currently being treated in hospital, and I'm pleased to report that now 3 of our earlier cases can be considered to be recovered. Along with our 90 positive tests, we have now tested 3,649 Nova Scotians for COVID, and all those people have been negative. So you can see that we are significantly increasing. I think it was yesterday we tested almost 450 people at the lab. You may have heard earlier today that the Nova Scotia Health Authority, the Public Health, issued a notification about possible exposures at a business in New Glasgow on March the 11th and a hockey tournament in Antigonish on March the 12th. I know that close contacts with individuals involved in both of these cases have been identified and tested. Public Health is taking the extra precaution of issuing this public announcement to try and identify any additional potential contacts. While today's numbers may be concerning, we are now 3 weeks into our response. And I see this as a demonstration, as I've said in previous briefings, that this is an indication of what we're putting in place is working, and it's a success. We have put in restrictions on returning travelers, first from outside of Canada and then outside of Nova Scotia, the requirement for them to self-isolate. Our cases are by and large adhering to that. We put measures in place for assessment by telehealth, and then a way for people to get in promptly and in a controlled manner with appropriate infection control to be tested. Public Health is rapidly following up cases. All those things are working, and I thank the Nova Scotians who are adhering to our requirements around self-isolation. It's making a difference in terms of limiting spread. So all the things we're asking, along with all the processes we're putting in place in the healthcare system, in addition to everything we're asking Nova Scotians to do, personal protective measures, physical distancing, limiting social gatherings. That's how we'll flatten the curve of COVID-19 and minimize spread. As I talked about yesterday, we have expanded testing. All close contacts are now tested. We're testing anybody that is referred to an assessment center from 811 is now being testing, whether they've had travel or not. Anybody who has to go to a hospital with respiratory symptoms is being tested. And as of today, we're now also expanding testing to include healthcare workers who work for NSHA, for IWK, and our continuing care sector. If they their occupational health program at NSHA has set up a 1-800 line. So any healthcare workers in those organizations who has respiratory symptoms and phones in, we will test them regardless of whether they've traveled or not. To me, that has 2 positive benefits. We are certainly taking every step we can to make sure to protect our healthcare facilities and protect the vulnerable people who receive care in those facilities, and being very cautious around testing healthcare workers regardless of whether they've traveled or not is an indication of that. Also, there are hundreds of healthcare workers in these organizations, if not thousands, and as we test them regardless of travel, it'll give us a strong sense of where there might be pockets of transmission in our communities as well. We know these are challenging times for all of us. Fear of the virus is real, and the necessary public health measures are causing significant disruption in all of our day-to-day lives. I've been encouraged by the way Nova Scotians have responded with caring, building community, and using common sense. Working together to keep each other safe and to support those who need our help is so important today. I want to thank Nova Scotians for doing that. However, and I unfortunately have to say this, that I've been made aware of a few cases where people who have been tested positive for COVID-19 or their contacts are being harassed in their community, are being harassed on social media. That is inappropriate. These people need your support, they need your love and caring. So I'm imploring everybody that we all need to be at our best here. We need to be kind, we need to be considerate, be there and be a friend. We are 3 weeks into this, and I know lots of people are getting tired. I certainly am. But we have a long road ahead. We need to continue to pull together, practice good hygiene, use the physical distancing, but also use technology and other ways to stay connected without being in person with each other. We need to support each other and protect our most vulnerable. By staying committed to keeping each other safe, especially those who are most vulnerable for getting severely ill, and that includes our healthcare workers who are every day putting themselves on the line and prepared to treat us if we get sick with COVID. Doing that is how we're going to decrease the impact of COVID-19 in Nova Scotia, and it's also how we're going to be able to return to normal in the quickest time frame possible. I also want to thank the many Nova Scotians who have been sending messages of support and encouragement to the Premier and myself, to my colleagues in my public health team, and the hundreds of people across the healthcare system. But I just get to be the public face, and while that's a challenge, but it's also enjoyable when I get the humorous memes, and it's good to get a laugh once in a while. I thank you for that. But I'm here representing hundreds and hundreds of people in the healthcare system, in public health, primary care, acute care, continuing care, who are working extremely long hours to do what needs to be done to help all of us stay safe. So, so when you're thanking me, you're thanking all of those people. I also want to recognize that there are many other regulated health professions, such as dentists, that have made significant adjustments. They have had to. We've asked them to shift to virtual care, but they are also willing to remain open to see people in person when there's urgent and emergent cases. So I want to thank all those professions as well. I'll end by sounding like a broken record, and I'll continue to sound like a broken record because it's important. Wash your hands, stay home, help each other, especially those who are least able to help themselves. We'll get through this by doing that.
Thank you, Dr. Strang. We are continuing to look at the impact of COVID-19 on Nova Scotia. Dr. Strang and his team are managing our cases, they're increasing testing, and we're continuing to remind us, as he just did, about the appropriate protocols. We are working with Dr. Strang and his team to make sure that they have the appropriate supports at public health that they require. But we are also focused on our small business and those that are most vulnerable. Many of our small business operators who were forced to shut down and leave their shops and storefronts are now worried about paying the rent. April 1st is around the corner and rent is due. We don't want you to worry. We are announcing a rent deferral program for small business operators who are forced to close under the public health order. Landlords will be asked to sign a rent deferral agreement, and government will guarantee up to $5,000 a month if that business goes under. The hope here is that these businesses will be able to come back even stronger, but if not, we want to reduce the risk on the landlord. If that is not possible, at the end of the lease, our government will guarantee that 3 months. We also know there are a number of restaurants trying to stay open by doing takeout and delivery. We will now allow them to include alcohol with takeout and delivery orders. Last week, we provided $1 million to Feed Nova Scotia, but there are other smaller food banks that are not part of their network, and we know they need our help too. We will be providing additional funding to support these 12 community food banks based on the volume of clients they serve. Both Dr. Strang and I talk a lot about the importance of picking up the phone and calling one another to check in. That is not possible for some. And so the Department of Community Service has entered into a partnership with TELUS to help our most vulnerable individuals who are required to self-isolate. Government will purchase up to 100 phones at a cost of approximately $50,000, and TELUS will provide data minutes at the value of $5,000 per month. These phones will be provided to those who have no other means to communicate. We also know vulnerable women and children also may need additional support at this time. That's why we will be investing $200,000 to support transitional houses in the province, as well as other organizations that serve vulnerable women and children. This money will be used to support cleaning protocols, as well as finding extra space so that the women and children can stay safe while observing physical distance rules. These are the latest measures that we are taking, but they are not the only measures. We'll have more to say of support from to our small business and self-employed, and we will always be keeping an eye out to protect the most vulnerable in our community. We will answer any questions that you may have now.
We'll now go to the phone lines to take questions from reporters on the phone. Again, we'll take one question and one follow-up from each outlet in the time allotted. We'll go to Heidi from CTV first. Go ahead, Heidi.
Hi, a question for Dr. Strang. Just wondering what are some of the more specifics about the circumstances, the events that the NSHA is warning about now? Is it that someone who already had COVID-19 attended these places? What more can you say about that and how this was discovered?
So this would have been uncovered as part of our follow-up of cases as we traced back and we realized that there was somebody who was infectious at these events. So as I said, there was at a let me just look at my notes here. There was a business on March the 11th in New Glasgow, and then at a hockey game in Antigonish on March the 12th. That what NSHA is putting out to people is that if you're at those, there's a low risk of being exposed, but you might have been exposed. And if you've got the symptoms of fever or new cough, to go like anybody else, to go and do the online assessment center, and then they'll direct you to whether you need to be tested or not. While in in both of these circumstances, people who we know were in close contact with the case have already been identified and tested, but NSHA Public Health has gone the next step just to make sure that there may be other people much lower risk of being exposed, but just wanted people to be aware, and if they now have COVID-like symptoms, that they need to get them in to be tested. I will say that these events took place 2 weeks ago, so it's anybody who would have been sick today is kind of like the last day they would have become sick. But it's important that if people since been at who were at those events in the last 2 weeks, if they have developed fever, new cough, that they identify themselves, get into 811 and be tested.
Go ahead with a follow-up if you have one.
Yes. Any of the new cases announced today, are any of those related to those two instances?
No, that announcement went out today, and so I would, over the next day or two, I would anticipate anybody, if people hear that notice and they have been sick, they will come in and be tested. And with every new case, we do an interview and a follow-up by local public health, and we would be then determining if they were linked back to these events.
Next, we'll go to Cassandra Nadeau-Lamarche from Radio-Canada. Go ahead, Cassandra.
Hi. So this is for Premier McNeil. So we have talked to a few police forces who've been expressing worries that people may call 911 to report the noncompliance to the state of emergency. So there are provinces like New Brunswick that have decided to create special denunciation lines. Is that something that's in the thoughts for you?
No, I strongly want to encourage all Nova Scotians not to call 911 unless it's an emergency. Law enforcement will be out in force this weekend. They continue to ensure that people adhere to the self-distancing, no group more than 5, ensuring that they're not on the beaches. What I want to ask all Nova Scotians to do is to do what is in your hands. each of us need to do and make sure that we're following all the protocols, and that should be our priority, and making sure that our friends and our families and those that we care and love about and those that we know are also adhering to those rules. And if we approach it in that manner, I believe we'll have the success that we're looking for.
Go ahead, Cassandra, with a follow-up.
Yeah, so this may be for both Dr. Strang and Premier McNeil. So can you tell us a little bit more if there are any risks in your knowledge in the use of reusable bags for groceries, and if you think we should or could temporarily bring back the single-use plastic bags?
So I don't see that there's any substantive risk from reusable bags. I think that's very low down on the possibility, especially if everybody's adhering to good hand washing, the cleaning in homes. I don't think this is a major issue we have to be concerned about.
Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Thank you. My question is regarding just a story that we've just published today. It's regarding an employee at the Superstore in Bedford, Nova Scotia, who has tested positive for the novel coronavirus. And my question for Dr. Strang would be, I guess simply that should anyone who shopped at this grocery store location be concerned about exposure? And is there a window of time where there's a real risk of exposure to the virus?
So I'm aware of this case. I had a conversation earlier today with Dr. Sarbu, who is the Regional Medical Officer of Health. Local public health has been working with the Superstore. We do know that the individual at this store was not working on the front lines, not in interacting with the public. There have been some close contacts in that workplace have been identified as fellow employees. We have given support to the Superstore around and advice on the appropriate cleaning of their store. And my understanding is that in order to carry out that cleaning, the Superstore has chosen to temporarily close down their store. But there really is a significant risk for any of the public who may have been in and out of that store.
Go ahead, Jesse, if you have a follow-up.
Thanks, Dr. Strang. I had a follow-up, and I was hoping it could be aimed at the Premier. Premier, I'm just wondering, with regards to the procurement page, the Nova Scotia Together, the province is asking for help from businesses and organizations that can supply emergency products and innovative solutions. And I'm just wondering, are we going to pay for this, or is this kind of a request for donations? Is this in anticipation of shortages?
No, what it is reaching out across all organizations. As I said earlier in the week, for example, our education department had N95 masks. We've redeployed those. If there are businesses that have them, as you know, we're part of the national procurement proposal. There's some of the distilleries at home here in Nova Scotia are now making hand sanitizer. And at the same time, we have a number of companies that are looking to retool here to make ventilators or gowns as part of that national movement. But of course, we'd buy them for sure.
Thanks, Jesse. Next, we'll go to Brooklyn Curry from CBC. Go ahead, Brooklyn.
Hi, thank you. This is a question for Dr. Strang. Earlier you said that 90 cases here in Nova Scotia was a success. Why?
So, I mean, it tells me that we actually we knew we were going to get disease here. The fact is not 90 cases having a success, but the fact that we have identified these cases and we put processes in place, requirements that people are following, that when they're testing, we're identifying that by and large they've had, with a few exceptions, they've had limited contact with other Nova Scotians. That is a success story. I do also want to point out that as we expand our testing, we will see more cases. So don't be surprised over the next week as we get more cases. That again, I see that as a positive. It means that we're more actively looking and we're identifying cases through our expansion of testing.
Go ahead, Brooklyn, if you have a follow-up.
I sure do, thank you. So given that we've tested only select groups of Nova Scotians under a certain criteria, and considering the number of people who've now tested positive out of the almost 4,000 people that have been tested, what does the modeling tell you about how many Nova Scotians might be infected with COVID-19 and not know it?
So we don't have any estimates of that, but what I've said earlier is that we're rapidly expanding our testing to start to identify Nova Scotians who may not have traveled but may be infected. So we're aggressively moving in that direction, as I've outlined today and yesterday. We're expanding our testing, and we certainly have substantive capacity in our lab to absorb that number of tests. So we're rapidly looking for indications of potential community spread and identifying people who in Nova Scotia who are infected, because our best strategy is to identify them and quickly move in with public health, isolate them, identify their contacts, test all their contacts, and then isolate people from there as necessary.
I just want to add to Dr. Strang and his team, like all Canadian provinces and other global communities, everyone was focused on the traveler. That was the original point of contact. That was where everyone began to fight this virus. Within the last 10 days, Nova Scotia began to move to aggressively go after the contacts of those that have tested positive. They broadened it out, changed the protocols at 811. The traveling is not a criteria. Looking now today, the announcement around healthcare workers, that's a testament, quite frankly, to the testing that's happening in our province that has become nimble. We've recognized that we would be able to put in place the original protocols to get people home, tell them to self-isolate, but then we knew we would have to go out into communities and broaden this. And the system has been able to respond where we went from having less than 200 tests a day to now, in the last 2 days, we've been over 450. That's a good news story for our province.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Hi, Premier. I'd like to ask you about the small business rent deferral program. You've been banging that drum now for the last week or so. Is this piggybacking on anything the federal government announced today? I'm not aware if they addressed this specifically. And if it's not, is this a sign that you've been frustrated with a lack of movement and you decided to go on your own?
No, we were looking at, so first of all, let me just say today, I thought the announcement the federal government made around wage subsidies is an important one for the country, but indeed for Atlantic Canada. It's my hope that the businesses who have been laying people off now will rethink that, hire them back at I think it's a 70% or 75% wage subsidy. That's a good news story. What we were looking for, and looking uniquely at Nova Scotia, is there are tremendous commercial lenders here, commercial developers who have, restaurants, bars, salons, small businesses in them. This program is directly targeted to them. Many of them have multi-use businesses. So, for example, one part of their building might be open, but another part closed. What we wanted to have for those commercial developers to say to their small business owners, defer their rent. Let them defer their rent. We will backstop you to take away any risk for you. We want you to work with them over the course of the remainder of their lease to be able to have them pay that back. And if they don't, we will be there as the government. Our number one goal is to have these employers in a position to come out of this strongly as soon as public health gives us the word to open up our economy again so that we can take off, and particularly on the service side.
Go ahead if you have a follow-up, Keith.
Yeah, is there any instructions as to how to access that and how soon can they start doing that?
Yeah, that would be on our website. We are reaching out to the different organizations now. The Department of Business, Minister McClellan has been leading this file along with his deputy. They've been in contact and they will be working out through that.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, thank you. I actually had a different question, but on the rent deferral, I'm understanding that you are guaranteeing essentially a loan to the small business people. Do you have terms for that, like percentage terms? And doesn't that, in effect, isn't that a transfer post-crisis of wealth from the small business person to the landlord?
No, what it is, not at all. What it is, the program is that we want the commercial landlord to defer the rent for 3 months. Then we want that commercial landlord to work with his tenants to work out new terms so how they can pay that back. What we're saying to the commercial landlord for doing that, and if this business fails and can't afford that, we will make sure that we cover the 3 months that we've asked you to defer. We believe this provides some security for the commercial lender to be able to do that, especially those that have a diversified portfolio, more than one business in a particular footprint. And it's also provides that small business owner right now cash at hand to be able to continue to move and get prepared for the opening. And then work out terms. So we believe the vast majority of these businesses will stay in business, is our hope. And this program is one to tell them we have the confidence in them, and to also tell the commercial lenders to work with their tenants, and we will be there.
Go ahead if you have a follow-up, Tim.
Yeah, I'm just going to press you on that, Premier. What you're saying is that the landlord is guaranteed $15,000 with government backing, and the small businesses, well, maybe if they survive, they'll be carrying that on as a loan into the future with uncertain terms, and maybe they won't survive. Why is it that the landlord should get the guarantee and not the small business?
Well, the reality of it is the landlord is owed rent on April 1st. So what we're saying is leave that rent in the hands of the small business owners, exactly what this is. It's actually for leaving capital in cash in the hands of a small business operator for 3 months and deferring an expense that they would have to pay. It is taking something off their balance sheet. What we're saying is we will guarantee that 3 months if you work with your tenant, which is the small business owner. This money will actually end up in the hands of the small business owner on April 1, not in the hands of the landlord. It will do the same in May and June. They will keep that to be able to get their business ready to come out of this challenging time to take off. They will, of course, have to pay that back. They'll work out an arrangement on their lease, just like they would in all of us would who would rent from someone, work out the terms of how you would pay back any deferred rent that you would owe.
Next, we'll go to Sharon Montgomery from the Cape Breton Post. Go ahead, Sharon.
Oh, hi. Thank you. I'd like to ask Dr. Strang, please, of the 90 now diagnosed cases, can you tell us about how many of those would be close contact cases?
I don't have the breakdown of how many are direct to travel or they're linked to a known case. I don't have that details in front of me of a specific numbers. I think the important point is we know that overall, the vast majority of what we know of the cases that have been followed up, we can link them directly to travel. Or directly or indirectly to travel, or link them to a contact with a known case, and that known case has had direct travel. So everything links back to travel in the cases that we have been able to complete investigations on at this point.
Go ahead, Sharon, if you have a follow-up.
Oh, thank you. Just one more for Dr. Strang, please. We know that testing has been expanded, of course, to include all close contacts. Have there been any cases of diagnosis yet of anyone who was not showing any symptoms?
We have had in our call, as was said earlier, we've started immediately testing contacts of cases, and I'm aware of 2 individuals who were contacts of a case who were not symptomatic and tested positive. There's been a lot of discussion on this point in the last couple of days nationally, and there's growing evidence that people may be infectious to others in the 48 hours before they become symptomatic, and that's one of the reasons that it's important that we jump on contacts and test them right away, and then every contact is self-isolated, whether they're positive or negative. But we're also doing the testing, and we're adjusting some of our other public health measures across the country as well, with a growing awareness of asymptomatic spread. Again, it comes back to it's really important that people who are asked to self-isolate, even if you're feeling well. You got to isolate for that full 14 days. If you do that, even if it's day 7 or 8 when you become sick, now with the growing evidence that maybe day 5 or 6 when you started to be infectious to others, but if you've been adhering to that full self-isolation, that's not you've been protected by sticking at home and avoiding others.
Thanks, Sharon. Next, we'll go to Chris Halef from News 95.7. Go ahead, Chris.
Thank you. A question for Dr. Robert Strang. Earlier this week, it was actually CBC that reported this. There was a woman who was referred by 811 to go to an assessment center, but when she got there, she was told she did not qualify for a test. I'm just wondering if you could comment on those types of situations and perhaps the learning curve for all parties involved when it comes to getting this right and testing accordingly, because obviously this situation is very new for a lot of people.
So I've been involved in conversations with 811 and the folks running the assessment centers on this issue. It seems to be in a lot of circumstances that sometimes the information that's presented or what people screen in through for 811, once they get to the assessment center, either their symptoms are different or their story of travel or not is different. And so we've removed that issue. And now, as I said, as of yesterday, once somebody is screened in at 811 through their teletriage and they're sent to an assessment center, we are testing them regardless, because that will help us to start to get a growing of Nova Scotians understanding people who may not have traveled, starting to test, but have symptoms, starting to test them as well. Again, it's another way we're expanding our testing out into the community, looking for community spread.
Do you have a follow-up, Chris?
Yes, I do. A question for the Premier. Yesterday, you ended off the update with a pretty stern plea to the public to adhere to social gathering rules. Are you confident that most of the public, given the weather we got coming up this weekend, will adhere to this? Or do you feel that some may still not be grasping the severity of this situation?
If they put the interest of their neighbor and their families ahead of their own self-interest, they'll adhere to the advice. Public health has told us that in order to control this virus and stop it from spreading, social gatherings of no more than 5. I'm asking those who are choosing to ignore that advice to think about their families, to think about their neighbors, to think about every other Nova Scotian. If we want to be able to control the spread of this virus, we need to listen to the advice we're getting from public health, and I expect Nova Scotians to do that.
We'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This is for Dr. Strang or the Premier. We've heard about cases where people have lied to their healthcare providers about their COVID status. And just yesterday, the Halifax police have said some people have told them they're contagious when they're not during traffic stops, I assume, I'm not sure why. The state of emergency laid out fines for people and businesses who break isolation orders and so on, but I'm wondering, does it cover the repercussions for people not being truthful about their status?
I don't know about the legal status, but I think it's, again, we're all in this together. So how do we work together to help each other out, and not being truthful about where you've traveled and not being truthful about your symptoms is just creating problems. As the Premier just said, we got to think about each other, not ourselves. Think about those who are most vulnerable, and we got to think about the healthcare workers. We have healthcare workers in this province who already are and are prepared and will step up and go to work, put themselves at increased risk to provide for care for people who are sick. The least we can do is do everything we can do to protect them and protect the vulnerable people in our community, and that includes telling the truth.
We have men and women who are going into our healthcare system every day. I want you to think about this for a minute. All of us are nervous and scared about this virus. I'm sure they must be. Imagine what their families are feeling like when their loved one walks out the door to go to provide us service in the healthcare system today. The very least we can do is to be frank and honest about where we've been and truthful about the questions that are being asked of us. You're not being judged by them. You're being asked of them to protect you, to make you healthy, and to protect those who are caring for us. That's the fundamental question here. Think about that for a minute. Think about if you're the family of that healthcare worker who's being denied the appropriate answer. It's not fair. It's simply not fair.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Premier, I'm sure businesses will be relieved about rent deferral and the wage support from the feds, but I've heard from business owners that they need more to make up for lost revenue. Have you ruled out direct funding for small businesses?
We're looking at what is available. There is a lot of capital that's available now. As you know, Minister McClellan announced a small business loan through the credit union where we would be backing the first 100,000. There's a number of programs at the federal level. But we are continuing to look at the unique circumstances of our province and how can we best build on those. The rent deferral program really was about the employees of these businesses. We're trying to prepare ourselves for when public health says we can now start opening up our economy to be ready to go. We have a good chunk of our economy still working. We've got a lot of tenders that we've put out through government around road construction, some other public tenders that we would be doing. We're trying to get them all out the door to have them tendered on and ready to go as soon as we continue to build on that activity. But we also want to make sure that the service sector is ready to really take off as soon as public health gives us the word.
Go ahead, Lindsay, if you have a follow-up question.
Yes, you've said that this an extra funding is coming and will be announced in just days now that the feds have announced their package. But we've seen other provinces already get on it and deliver money. Ontario rolled out a $17 billion package just 2 days ago. What are you waiting for in bringing this forward?
We want to make sure, quite frankly, that the investments that we put out are there that will sustain jobs. This is about making sure that the Nova Scotians who were employed before we had to turn down the economy will be reemployed. Every province is doing things differently. We've taken a different approach working with public health. We shut down our borders faster. We closed down bars and restaurants quicker than most Canadian provinces. Every province will do what they believe is in the right, and we will do what we believe is in the best interest of our economy. And our economy is different than Ontario's, which it's different than others. And the investments that we will make will be triggered by working with our private sector. But it's about jobs. And for every job, there's an employer. We need to make sure that employers, when this is lifted, is still ready to risk their capital, still ready to risk the economic stability they may have to employ all of us. And that's what we're focused on. How can we continue to make sure that these operations that we're employing Nova Scotians are ready to go as soon as public health gives us the word?
Next, we'll go to Kyle Shaw from the Coast.
Hi, thanks, Tina. Question for Premier McNeil. Public schools are closed next week, but we're hearing a lot at these briefings from you and Dr. Strang of physical exclusion measures lasting 6, 8, maybe more weeks. So it's hard to imagine the public schools will reopen the week after. So I wonder what's the progress on rolling out remote classes for all grades?
So there's an ongoing conversation with education and our partners about how we look at continuing to put education online, virtually, what are the opportunities that are there, and we'll have further announcements to make about the public education system. But I think it's fair to say that the closure of schools will be longer than next week.
Do you have a follow-up, Kyle?
Yes, thanks, Tina. So about grade 11 students and grade 12 students in particular who are starting to think about applying to universities and they're worried about their grades. Just wondering, at the level of provinces and universities, have discussions started yet, as far as you know, for how to accommodate these students?
Of course, those that are in grade 12 in their final, it's a long time ago, but I remember my final year in high school was an important year. It was one of lots of exciting things. So we're recognizing that, there's a group of young Nova Scotians who have had that substantially interrupted. We want to make sure that we, though, provide them with the academics they require so that they can start their post-secondary education on time. We're working very hard with the teachers union and the ministers working with them, and the department is working with them. We're also working with our universities, so we're certainly concerned about the fact, as you know, we welcome a lot of Canadian students here and international students to come to start in September. So these are all important steps, but right now, What will be our main focus is following the advice of public health to keep our children safe, to keep our students safe, and then focus on making sure that we can salvage the year for them so they can go off to university, and at the same time prepare our economy when we get the go-ahead to open it up again.
Thanks, Kyle. That's all the time we have for questions today. Go ahead, Frank.
Thank you, Tina. I want to say thank you to all Nova Scotia accept visitors. This was done to protect their health. I have seen images of grandkids having to visit through the glass, loved ones sharing a smile through the window. We want to make it easier for the elders to stay in touch. That's why I'm announcing today the purchase of iPads. Up to 800 tablets will begin to arrive at long-term care facilities throughout the month of April. Our seniors will not only be able to see their grandchildren, but they will be able to hear them laugh, see the crafts they've been making, and get a virtual hug. I know this has been hard on everyone, but I need you to follow the rules. Continue to show love, be kind, and do it from inside, not outside.